Hypoplastic metatarsals. Beyond cosmesis. Definition. Hypoplastic metatarsals or idiopathic brachymetatarsia is relatively frequent diagnosis in podiatric practice. Patients with this abnormality typically seek surgery because of cosmetic concerns, difficulty wearing shoes, or foot discomfort. Hypoplastic metatarsals may be accompanied by other physical features, most often related to Albright's hereditary osteodystrophy. Application in medicine. Patients with either form of pseudohypoparathyroidism presents with parathyroid hormone PTH resistant hypocalcemia and hyperphosphatemia and may have resistance to other hormones. Pseudohypoparathyroidism type 1A is caused by maternal inactivity mutations affecting GNAS exons 1 through 13, and type 1B is caused by maternal GNAS or STX16 deletions. Paternal uniparental dysautonomy involving chromosome 20q or as yet undefined genetic mutations that alter GNAS methylation imprints.
Cynthia Diaz is accustomed to keeping her feet under wraps, her toes especially.
People would look down at my feet and be like, oh, what's wrong with her feet?
She was born with a foot deformity called brachymetatarsia. More common in females, it usually occurs when the fourth metatarsal bone doesn't fully form, resulting in a tiny toe that looks like it's growing on top of the foot.
It can cause the toe to look deformed, where you have a toe that's pulling up and back because the bone behind it is not long enough to support it.
The condition can lead to balance problems and foot issues. When Cynthia started experiencing pain wearing shoes, her parents sought help.
Then the more we investigated, the more it caused other health problems, and that's when we came to Dr. Ellis.
He offered a foot fix, sometimes called toe lengthening. Doctors actually break the toe bone, then attach this external fixator which pulls the bones apart, encouraging new growth.
And basically, you have two connections on either side of the bone. You cut the bone in between, and you slowly stretch out the whole bone.
It doesn't happen overnight, but is amazingly fast.
Usually, we can get about a millimeter of bone growth per day.
Patients turn a screw 4 times a day until enough length is achieved. Most people have brachymetatarsia in both feet. Cynthia had the other one fixed.
It's really cool to kind of look at it sometimes and then compare feet.
With one down and one to go, once the second surgery is complete, Cynthia will be in good standing for the first time in her life.
I used to walk differently because now the weight kind of shifted on my feet, so I walk more like forward and my feet.
The procedure takes 2 to 3 months to complete.
There's a time of growth, and then there's a time of healing, at which point you can then take the device off.
No pins or plates are left behind, and the foot looks perfectly normal. Her parents expect a lot of shoe shopping in the future.
Oh, definitely. Yeah.
They understand the effort it took to walk in Cynthia's shoes. For Lee Memorial Health System, I'm Amy Asher.
The pros and the cons. Because such patients typically retain normal calcemic through PTH-dependent bone resorption, preoperative testing of patients who present the lane and insulated form metatarsal or metacarpal should include PTH measurement, even in the absence of the other features in Albright's hereditary osteodystrophy.
For millions of Americans, foot problems are a major cause of pain and disability.
Most of us don't think twice about our feet until we have problems, and those problems start affecting our daily lives. But for some people, foot deformities such as brachymetatarsia, that's a common condition where the foot is abnormally short and causes the appearance of a short toe. The pain, the embarrassment, and problems they endure are on a daily basis. Board-certified podiatric surgeon Dr. John Doolan of the Brachymetatarsus Correction Center of New York tells us about treatments they offer to help their patients stay active and on their feet.
Brachymetatarsus is a term that's used to define the length of the metatarsal. The metatarsal is the bone in the foot that is responsible for determining the length of the toe. So people who have this deformity have a short toe. It is caused by a congenital or a birth defect that starts around age 8 and fully develops around age 15. These people have a shortened toe, which can be painful.
Now let's find out about treatments.
There are two main treatments for this disorder. They are determined by the length of the metatarsal. If the metatarsal is not so short, we can use a bone graft with screws in place. If the metatarsal is excessively short, we need to use an external fixation device and gently and slowly lengthen the bone. This process takes about 2 months, where the first process takes about 6 weeks. When using the external fixator, the patient comes in for surgery, and we actually break the bone and put pins and an external fixator on the person's foot. Then, the patient themselves lengthen slowly over a course of a period of about 3 weeks the bone. It has to be done slowly so you don't stretch the nerves and vessels out too much. After the length is obtained, we take off the fixator about a month later.
The Brachymetatarsus Correction Center of New York offers advanced choices for all your foot.
Conclusion. This case shows that insulated shortening of metatarsals may be the initial evidence for pseudoparathyroidism type 1b, a disorder that can go unrecognized for extended periods but that often causes severe hypokalemia.